Assalamu alaikum everyone. I hope you all are fine, good and doing well. So let me introduce myself first. I am Astra Nadeem and today I'm here to represent MPO, Muhammadi Physiotherapy Organization as a host. MPO was a dreamy project of Dr. Shaukat Ali, the founder, the president of MPO Muhammadi Physiotherapy Organization. And the motto is to promote physiotherapy in all over the Pakistan. Today, we are going to discuss about K-tapping, and the guest speaker of today's webinar needs no introduction because she is a well-known physiotherapist. She did her bachelor from Liaquat National Hospital. She did her master from Dow University, and more she did ADPT from Ziauddin Medical University. She is a lecturer therapist at SIPMR. Uh, First of all, I must say she is a gem of kinesiology, and the amazing fact is that she is my teacher too. So warmly welcome none other than Dr. Urooj Khan.
Assalamu alaikum, Asra. How are you? And
Walaikum
thank you for
assalam.
the lovely introduction.
Thank you, ma'am. Okay, ma'am,
Okay, so
just
will
give
we
me one
start?
minute. Ma'am, just give me 1 minute. Okay, so guys, if you have any questions, you can write in the comment section and don't forget to subscribe the channel. Okay, ma'am, now over to you.
Okay, thank you. Okay, so good noon to all, and today we are going to discuss about the K-tape. Let me show my screen first. Okay, so is it my screen sharing to you all? If someone, could you please let me know?
Yes, ma'am.
Okay, so today we are going to discuss about the Kinesio taping for the musculoskeletal disorders. Um, First, I would like to discuss about the K-tape. It was first described by or the first applied by the practitioner, Dr. Kenzo Case. Before that, there was conventional taping was used in sports therapy or for this sports person, but that was not for resolving all the issues. For Before kinesio tape, it was like convention tape is for to restrict the mobility of the sport person. But when Dr. Kenzo Case introduced the K-tape technique, it was used for the natural healing system of the body, and it activates neurological and circulatory process. But this as well, it promotes the mobility of that part of the joint of that muscle, and if there is any muscle overload or muscle injury or any ligament injury, so it could also prevent that area as well, or it could also prevent the bruising, or it could also support the part of your body. It could also support the joint that is affected, or it is also used for the correction of any joint uh, mobility or joint alignment, right? So it is influencing the muscles through the skin input as it is adherent to the skin. It is applied at the skin, so it gives proprioceptive stimulus to the skin, and it enhances the circulation, and it increases the oxygen supply of that area, and it gives improvement at that area. So, with the kinesio tape, as we already discussed before kinesio taping, there was conventional taping that was applied to the sports person. Basically, before before the application of kinesio taping, or before uh, Dr. Kenzo introduced the kinesio taping, there was conventional taping that was applied only to the sports person. But nowadays, kinesio taping is mostly used in to resolve the musculoskeletal issues. Basically, the difference between the conventional taping and the kinesio tape is that conventional tape is not gives anyone the mobility. It is The mobility is provided by the kinesio tape because it is elastic. In comparison with the kinesio tape, conventional tape is not as much elastic, and it is wrapped in many layers to the person, and it restrict or immobilize that portion or that joint or that muscle. So basically, for immobilization we apply conventional taping, and for to improve the mobility, or to improve the circulation, or to improve the lymphatic drainage, we apply the kinesio taping. Kinesio taping is much better than the conventional taping, because it restrict the movement, and it improves the circulation, and it is whenever a sports person applied it, they could play with the application of kinesio tape. In comparison with conventional tape, whenever a sports person applied the conventional tape, they were not able to use that part or that joint. So basically, this is the difference between the conventional taping and the kinesio taping. So nowadays, we are using kinesio taping in our OPDs, in our setups. This is not restricted to the sports person. Before the year, I guess 2012, kinesio taping was not available in Pakistan. But nowadays, kinesio taping is easily available in all over the Pakistan. You could get kinesio taping through the medical stores, and they are available in many different colors, and there are many different companies which provide kinesio taping. So there is no difference for the color. Colors are only for the application purpose, like in advanced countries or in modern countries, colors are picked to apply in a gender. So they um, introduce K-tape in many different colors, like in pink, blue, black, and brown, or a skin color. Basically, there is no the adherence of the K-tape is not colors. Otherwise, there is no big difference between the colors of the K-tape. So you could choose any of the color that you like. And if we talk about the properties of the K-tape, so it's made up of cotton. So all those persons whose skin is sensitive to apply anything, it does not provide any bruising or any irritation to the skin. You could apply K-tape uh, for maximum 2 days or 3 days, and after 3 days, you should change the K-tape. But before the application of the next K-tape, you should prepare your skin before applying that. You could wash your skin, and you should apply some moisturizer to your skin, because something is adherent to your skin for a long time, right? And K-tape has the capacity to stretch. It is very stretchable. Yeah, you could stretch it to the 25%, to the 50%, to the 100%. So you could apply K-tip with this stretch. It is stretchable. So all the movements, all the normal range of motion are very easily performable after the application of K-tip, and it allow air and water to pass through. So there is no chance after applying the K-tip that you could not bath or you could not apply anything at your body. You could apply K-tip. There is no issue on that. There is no harm. Cold pack could provide an effect easily after the application of K-tip, and water and air could pass through the K-tip. So this will not give you any harm. This will not restrict anything. And its hypoallergic gluing surface will hold for days. If you will take uh, the good quality K-tape, it will stay for the 2-3 days. And if the quality is not good for the K-tape, so it will only stay for a day or 1.5 day, and after that it will remove from your skin, and you have to reapply the K-tape. But that's for the quality of the K-tape. If you will take the good quality K-tape, it will give you more gluing property, and it will stay for more days. And yes, it will gives you complete range of motion. And sometimes when you apply it for those muscles who are overactive and with their contraction, you will feel pain. You will restrict range of motion because of that movement, because of that inflammation of the muscle, or because of over movement of the muscle. So if you will apply the K tape or the Kinesio tape on those muscles who are overactive, so it will give those muscles relaxation. It will deload those muscles, and it will decrease the workload of those muscles. And yes, it will provide you a complete range of motion with lesser pain, and it will subside the pain, and it will increase the circulation, and it will gives you a better pain-free life. If we talk about the type of strips that we could cut through the K-tape, all these strips could be cuttable through our simple K-tape. You could cut K-tape in a I strip, or you could cut K-tape in a Y strip, or you could cut K-tape in a fan shape, or you could cut K-tape in a donut shape. This is a I strip, Y strip, fan strips, and the donut strip. Why we apply these different type of strips, and when you should apply these different type of strips, this we will discuss in a few minutes. But at different surfaces, at different places, you could apply K-tip in a different ways. So these are the type of strips which you could cut and apply at the different conditions. Okay, so the next is the kinesio tape effect. It decreases the pain and it improve the joint alignment and proprioception, and it improves the lymphatic drainage. How kinesio tape decreases the pain? As we have discussed, the kinesio tape um, apply at the area and it deload the overload muscle, or it lift the muscle. So whenever kinesio tape lift the surface, the muscle, so it provides the area, or it creates the area between the muscle and the arteries and the lymphatic channels. Whenever the um, area or the surface increases, it will increase the blood circulation, it will increase the lymphatic drainage, it will increase the blood circulation, and it will increase the oxygen supply to the area. And whenever the oxygen supply improves at certain surfaces, at certain area, so it will remove the waste products from that area, and it will decrease the pain at that area. And yes, kinesio tape also improves the joint alignment and proprioception because of its adhesive property. And how it will improve the joint alignment? Because it gives you awareness. Like if you have a faulty posture, if you um, lean forward, um, if you if you could not um, stay proper, if you could not sit properly, so it gives you a proprioception. It gives you awareness that you are going in a wrong direction. And whenever you are trying to slouch yourself, whenever you're trying to maintain the faulty posture, then it will realign you, and it will stretch you back, and it will realign the joint, um, and it will give a sense of proprioception to you that you are sitting in a incorrect position, and you should sit in a correct position. So yes, kinesio tape also align the joint alignment. And yes, if some of the ligaments are torn or damaged, and because of the damage of that ligament, your joint is unstable, so it provides you instability to stay in a correct position. So in this way, it could improve the joint alignment and proprioception as well. It decreases the pain, and yes, it improves the lymphatic drainage. Whenever the circulation of the body improves, it will also improve the lymphatic drainage through the lymphatic channels. So without wasting time, let us discuss about how you could apply kinesio tape in different conditions. I could not cover all the conditions, all the muscles, all the ligaments, but I would like to give you a basic, uh, the basics for how you could apply in different conditions uh, the application for the kinesio taping. So for the conditions in which your muscle is overused, um, when your muscles could be overused, when there will be inflammation of your muscle, in the case of tendinitis, um, or if there is chronic overuse of the muscle, or if there is faulty posture. So in these conditions, you could apply how you could apply the K-tape, how you could apply K-tape for the muscles that are overused. You should apply K-tape with no tension. Like you don't need to apply K-tape with tension, and from the insertion of the muscle to the origin of the muscle. You need to apply K-tape in the direction of insertion to the origin of the muscle if you need to deload the muscle. And you should stretch the muscle before application. Like, for example, if you need to apply K-tape for trapezius overload or at the trapezius muscle. Mostly you found trigger points at the trapezius muscle, so you could apply K-tape at trapezius muscle. So how you could apply it, I have some videos for you. Okay, so in this model, I'm going to apply K-tape at the trapezius muscle, and trapezius, for the application of trapezius muscle, first I stretched the trapezius muscle as much as she could perform it, and then after the stretch at the trapezius muscle, I measured the K-tape um, length, that how what should be the length of the K-tape. Then I cut at this strip, and this is the I-shaped strip that I cut for the trapezius muscle. And now I will cut the corners of the K-tape. I will cut the corners of the K-tape in a round way, just to improve the adherence of the K-tape. After I cut the corners of the tape, then I peel the adhesion strip and I stretch again the muscle, and I applied it at the chromium process, and now I peel off the adhesion strip, not completely. I left it at the end, and then without any stretch at K-tape, I applied it over the trapezius muscle. And then I applied it end without a stretch. And I warm up the K-tape just to improve its adhesion. Now there is another muscle K-tape application. This is for the scalene muscle. As you all know, scalene flax your skin, and It's same ipsilateral side flexor of the neck. So for to keep it in a stretch position, I just perform extension and side flexion to the opposite side, and then I apply, cut it K-tape for the scalene muscle in a Y strip, because the scalene muscle has three fibers: anterior, middle, and posterior, and it makes the triangle of the neck. So I cut it the K-tape in a Y strip. How I cut it K-tape in a Y strip? Just simply first cut it in a I strip, then cut it from the mid, cut at the corners of the K-tape, and then again the application will be the same. We will not stretch the K-tape, we will only stretch the muscle. I will apply neck extension, opposite side flexion, and same side rotation to stretch the scalene muscle. And then I applied the anchor of the K-tape at the transverse process of the C3, C4, and then I applied in a direction of muscle without a stretch. After the application, I just warm up the K-tape just to improve the adhesion. And you could see the some of the wrinkles after when she comes in a neutral position. So these wrinkles in tape shows that your muscle is deloaded now, right? You could also apply K-tape for to improve the activation of the muscles, to improve the strength of the muscles. So how you could apply K-tape for your weaker muscles? You could apply K-tape with light tension in this case, and for activation of any muscle, you need to apply K-tape from the origin to the insertion direction. And yes, this can must be stretched before the application. And if you need to apply the K-tape for the ligament tear or for the ligament injury, so you need to apply K-tape with the medium to the maximum tension or with the maximum stretch at the K-tape, right? So let's see. I'm going to apply K-tape for the activation of deltoid muscle here. I just measure the length of the K-tape, how much I would apply K-tape, and I cut the corners of the K-tape. And to apply K-tape at the deltoid muscle. I cut it in a Y strip again because, as you all know, deltoid has the anterior and the posterior fibers. So I will apply one strip at the anterior fibers and one at the posterior fibers. I'm cutting the corners of the K-tape here. Now I peel off the additional strip from the anchor, and now I'm going to apply the anchor just at nearby to the chromium process. And when I need to apply the K-tape at the anterior fibers, I will keep his hand in an extension position, and then I will peel off the adhesion strip, not completely, and I will slightly stretch the K-tape and applied it at the anterior fibers of the deltoid muscle. And then I will keep his hand in a flexion position, and then I will apply it. K-tape at the posterior fibers, and I will warm up the K-tape, and that's it. So you will apply K-tape at the deltoid like this, and for you could apply K-tape for the correction technique as well, like here. First, I will cut a white strip K-tape and applied it with the center stretch 50%, applied it at C6, C7, and T1 surface area. And for this patient is in flexion position. The head of the model is in the flexion position. Then I cut the K-tip strip into a Y strip, and then I will apply it at the multifidus muscle. Here I'm cutting the corners. With the flexion at the neck, applied it just inferior to the occiput. And in this video, I will show you, see, this is the 100% stretch, this is 75, and this is 50. So you could apply this K-tape with the 50% stretch for the correction technique. 50% stretch. This is for the correction technique. With this, some persons who have the forward head posture or the dorsum bend their neck, you could apply this technique on those persons or patients. The next one that I'm going to show you is for the application of lymphatic drainage. For the lymphatic drainage, we apply K-tape in a pen strip shape. You can see now. I'm applying this pen strip at the forearm. Here first, cutting the corners of the K-tape, and then you need to cut this K-tape in a fin shape. So mostly we cut K-tape in a 4 strips or 5 strips. I cut it this tape into 4 strips. Here I'm cutting the strips. Then we will cut the corners of the strips just to make it more adhesive. Whenever you applied K-tape for the lymphatic drainage, just go in the direction of lymph nodes, and you need to make a channel for it. I applied it at the medial medial side at the forearm, and then I will apply all these strips in a downward direction with a 50% stretch at K-tape. You could apply it whenever you have any patient with the bruising or with the swelling or with the decreased lymphatic drainage. So for improving the lymphatic drainage, you could apply it. After this, I just warm up the K-tape. And that's it. So there are some contraindications for the application of K-tape when you could not apply the K-tape in these conditions like overactive malignant cancer, patients with areas if you will apply the K-tape. So there might be chances that it could, the cancer or the malignant things could spread to the other areas, or those persons who are fragile, or those areas which are healing tissues, but you could apply tape at the proximal or the distal surface, or overactive cellulitis or infection area, you could not apply K-tape at that area, or at the open wounds, but yes, you could apply K-tape at the proximal part, or in the area of DVT, because it will restrict with the DVT, there is restriction at the blood flow, and when you apply the K-tape, um, it could deteriorate the condition. We will continue this after Azan.
Assalamu alaikum, ma'am. Can you hear me? सॉरी मैम, आपकी आवाज नहीं आ रही है. स्टिल नॉट.
Could you hear me now?
Yes, ma'am.
Okay. So in the area of DVT, we should not apply K-tape. Um, because it stops the circulation. Already there will be a thrombus formation at that area, और जब हम उसको वहाँ पे केटिव कर देंगे तो it will create some problem there. And with patients with known tape or adhesive allergies, some people have allergies with these type of K-tapes, or with adhesive things. So in those persons, we should not apply K-tape, because if you apply K-tape in those patients or the persons, so it will peel off the skin of those persons. And instead of giving a benefit effect of K-tape to those patients, you will give a harmful effect to those persons. So you should not apply K-tape in those persons or the patients who are allergic to adhesive things. That's it from my side, and there's a quote for you all, and you all should continue. Uh, Keep yourself to make you um, a better way, a better person, a better therapist, from every uh, aspect. And you should work on your personality, on your skills, uh, for the better growth. That's it. Thank you so much. If you have any questions, so you could ask.
Okay, ma'am. Ma'am, as usual, you was best and the lecture was awesome. So, आप question answer start करते हैं.
Yep, sure.
Okay, guys. So, if you have any question, to write in the comment section.
For the ligament, I did not show any video. For the ligament, if someone has the ligament tear in a grade 1 or grade 2, you could also treat the ligament injury with the application of the K-tape. How you will apply it? Just simply no stitch at that area, and total 100% stretch at K-tape, and apply in the direction of the ligament. Just that's it. That's the technique. If someone has any question, you could ask.
Ma'am, yes. Ma'am, can get tapping wear in sleeping and in swimming, or we remove it while swimming or sleeping?
Okay, Dina Lohana, you could easily wear K-tape while sleeping or swimming. There is no harmful effect of applying K-tape, and as it has very good adhesive qualities, and it passes the air and water through it, so there will be no side effect. Your K-tip will not affect it while in swimming or sleeping, if you have a great quality K-tip.
Okay, ma'am. Now, can we use hot pack with K-tap?
Yes, you could apply hot pack or cold pack with a K-tape. There is no harmful effect on that.
Okay, ma'am. So, ma'am, next, ma'am, how we will know that this is the best time to apply K-tap? How will we know that this is the
Sadia,
best
this will be your judgment. This will be your skills that you need to think that this condition requires K-tape or not. But for certain conditions, like if someone has a tendinitis, or if someone has overload syndrome, um, like many persons or many patients have trigger points in the body, so you could apply in that condition. Or if someone has a faulty posture, or if someone has a ligament tear of grade 1 and grade 2, or for If someone has ligament injury and their joint is unstable, so you could apply K-tip in those conditions. Do you got your answer, Sadia? You're welcome, Bisma. Anything else do you want to ask?
Yes, ma'am, Sadia, right there. Thank you so much, ma'am.
Okay. I just described the
Ma'am,
basics of the
Sadia,
K-tape. You could apply it at any muscle or you could apply it at any joint.
ma'am, Sadia is saying you are the best therapist ever.
Thank you, Sadia, for the compliment.
Okay, ma'am. So,
Do we have any other question?
yes, ma'am. Ma'am, is K-tapping is most benefit for pain relieving and gain ROM or other modality like TENS? Benefit for pain
Um,
relieving and gain range of motion or other modality like TENS.
Dina, K-tape it's not like TENS. What TENS do? TENS work on a pain gate theory, while K-tape gives you more proprioceptive receptors. It will improve your receptors, and it will create or gives you a sensation that there is something wrong and you need to correct it. And when you apply K-tape at any area, it lifts the skin, and whenever it will lift the skin, it will relieve the pressure from that area, and it will increase the blood circulation, and it will remove the waste products. uh, the application of TENS and the application of K-tape is a completely different thing, and the role of K-tape and the TENS is completely different. Evidence said that K-tape gives you pain relief, gives you instability as well, uh, increased lymphatic drainage as well. But if we talk about the TENS, so TENS will not provide you stability, right? So TENS and K-tape are different from each other.
Okay, ma'am, next time, ma'am, can you repeat the corrective technique indications?
Corrective techniques, like if someone has a faulty posture, forward head position, upper cross syndrome. So in these conditions, you could apply corrective techniques. Like for a rounded shoulders, you could apply in a cross direction K-tape, two strips in I shape. You will apply K-tape from acromion to the next opposite side is scapula. So it will correct your position, like it will keep you in a elongated backs and an upright position.
Okay, ma'am. So next time, ma'am, can we do exercise after just applying K-tap or either after remove it?
Yes, we could definitely apply K-tape because it will not restrict your mobility. It will gives you a complete mobility. Like अगर आपके पास if you have any muscle um, which is overused, and you apply K-tape to deload it, So after deloading, you could perform that muscle function as well. It will not create pain to your body after applying K tape.
Okay, ma'am. Any other questions?
Sorry, Isra.
Okay, ma'am, there is another question. Ma'am, am I audible?
Sorry.
Ma'am, can you hear me?
Yes, yes, I could hear you.
Okay, ma'am. So there is another question. What is the DVT in contraindication?
DVT is deep venous thrombosis. In deep venous thrombosis, there is a thrombus formation at the lower limb or the upper limb at someone's body. So if there is a thrombus formation at any side of the body, so it will restrict the blood circulation. It will not properly circulate the blood. So if you will apply the K-tip in that area, so it will increase the blood circulation before the thrombus, and at the area of thrombus, it will again restrict blood circulation. So before giving blood thinning medicines, you should not apply K-tip at deep venous thrombosis condition.
Okay, ma'am.
DVT is deep venous thrombosis.
Okay, ma'am, can we use it in diabetic condition?
Yes, you could use it in diabetic conditions, but if the condition of diabetic patient is very sensitive, you know that after application of your K-tape, their skin got peeled, or if there are the chances of skin peeling, then you should not apply K-tape in those conditions. But yes, you could apply K-tape in diabetic patients. There's no contraindication.
There is another question. Can we avoid it plus CVA?
Yes, you could apply KTIP in placid stage of CBA. You could apply in those conditions with the जो हमने अभी हमने बात करी थी कि एक्टिवेशन के लिए हम we will go from origin to insertion direction. So yes, you could apply KTIP in this stage of CBA, placid stage of CBA. It will increase the proprioceptive receptors of that patient. Thank you, Vijay, for
Okay,
giving me
ma'am.
the platform.
Okay, ma'am, that's all. Thank you so much, ma'am. Thank you for your time. Please
You're
share
welcome,
your
Nisra.
feedback. Okay, ma'am. Okay, all of you, please share your feedback with us and don't forget to subscribe our channel.
Thank you so much. Allah Hafiz.
Allah Hafiz. Okay, everyone, Allah Hafiz, and don't forget to subscribe the channel. Thank you.